Hello, my name is David Perez. I'm a second-year student pharmacist. Today in the urgent care clinic, we were presented with RI, a 26-year-old female with past medical history of depression, history of pharyngitis, coccidial meningitis, for which she's still being treated, history of latent tuberculosis, history of recurrent uncomplicated UTI. Today's chief complaints were shortness of breath, cough, tiredness, which had been present for 4 days. Upon examination, it was discovered that she did have an increased temperature at 39.3 degrees Celsius, a respiratory rate of 24, so elevated, moderate respiratory distress, difficulty breathing, and was given the diagnosis of community-acquired pneumonia. Patient is allergic to Bactrim, antibiotic, and develops a rash when takes that medication. So coming to conclusions and recommendations with that information at hand. For the community-acquired pneumonia, coccidial meningitis, and depression, I prepared a therapeutic strategy. For the community-acquired pneumonia, I would like to do doxycycline 100 milligram tablets 2 times a day for a total of 5 days. With the respiratory distress, difficulty breathing, and some chest discomfort, I would like to do, and for her fever, I would also like to recommend acetaminophen 325 milligram tablets. Every 6 hours is needed for pain. She can minimize the intervals to every 4 hours if pain is not well controlled, making sure that she does stay under 4,000 milligrams a day. For the respiratory distress, difficulty breathing, and wheezing, I would like to recommend albuterol inhaler, HFA, for acute treatment. She can do 2 puffs by mouth. Every 4 hours is needed for shortness of breath. My rationale behind choosing doxycycline as our therapeutic drug option is the simplicity of having one drug. The patient is also on voriconazole and citalopram, voriconazole for the coccidial meningitis and citalopram for depression. Those 2 drugs in combination does increase her risk of QT prolongation, which is why I chose not to go with more traditional methods or more traditional therapeutic options for community-acquired pneumonia like fluoroquinolones or azithromycin, just because that would further increase her risk. And now it's well controlled. Her QT prolongation is under 500 milliseconds, which is what we want. So continue to monitor that, but we wouldn't want to go ahead and add another drug that would increase that risk. For the coccidioidal meningitis, she's on voriconazole because she didn't want fluconazole due to the risk of losing her hair. I would like to continue with the voriconazole and just also keep on maintaining and monitoring QT prolongation or QT measurement at all scheduled visits. For depression, we would like to continue with citalopram 40 milligrams daily. Our goals of these therapies our goal of this is to minimize depressive symptoms. Upon examination and the information we were provided, we weren't given the information as to how well her depression symptoms are controlled. So we would like to do a DSM-5 to assure that the citalopram medication she is on is effective. I also looked at vaccinations to make sure she was up to date. I see here that she did get her flu shot, which is great, but she needs to get a Tdap vaccine. That would be every 10 years, so we can schedule that either in clinic or refer to a pharmacy. So we would like to continue to do that. It is important for the patient to remain hydrated, so oral rehydration is appropriate. The medications that were decided and everything that I do recommend is appropriate for outpatient therapy. Given the patient's condition, I don't think admitting is or referring to a hospital or emergency department is needed. Thank you so much for your time.